with this amazing presentation. At the end, I will come back with the questions, and then we go from there.
Perfect. Perfect. Thank you very much. I really
Thank
appreciated
you
the
so much, Doctor.
introduction.
Thank you, Dr. Badawi.
And also, I would like to thank Clarion for sponsoring this event and those 2 days. Yesterday, we spoke about the 4D rejuvenation and the concept of 4D. And today, we are continuing by some other new applications of the SP Dynamis laser from Photona, which is having both Nd:YAG and ErbMYAG lasers. Very unique Nd:YAG and very unique ErbMYAG. Both the components of that laser are really totally different from any other laser system containing Nd:YAG or containing ErbMYAG. And that's why wherever I work, I insist to have that laser, whether it's Canada, Kuwait, Qatar, Egypt, Saudi, Hungary, wherever I'm using lasers, I do insist to have the SP Dynamis as one of the most efficient and most safe lasers to work with. We have 2 topics today to cover: the laser treatment of snoring, which is very interesting, and then we are going to talk about the hair restoration with the laser, which is something I did not believe initially that's going to work. However, the reports we are seeing from all over the world are confirming the effectiveness and the safety of that treatment. So we'll start with the snoring, which is, again, something we didn't expect that we are going to go that far using the lasers, where we are able to aim a laser beam towards a tissue, and then no damage happens. However, the desired improvement is being achieved with no pain, with no side effects, with no downtime. This was, as I was just mentioning a few minutes ago, it was a dream, which is really becoming true now. So what is the issue of the snoring? Before we go to the snoring, I just want to remind you with the fact that with the ErbMYAG laser, if we are using a short pulse ErbMYAG with high fluence, we achieve ablation. However, with the same wavelength, if we are using subablative fluence with long pulse, we get some sort of coagulation. Let us not use coagulation because this is not what we aim at, but just heat. And this heat is going to make some changes in the tissue. Yesterday, I did operate a video, but it caused some issues. And with this video, we were able to demonstrate that if you are using short pulse of erbium on the tissue, it is just ablation. The tissue does not shrink. However, when we are using longer pulse, the tissue and the skin shrinks because of the heat deposit under the surface of the skin. This is making just like when we have a wool plover or something, and if we put it in warm water, it is going to shrink. So whenever we have something wool, it has to be dry cleaned or cleaned with not warm water, with cold water. Otherwise, it's going to shrink. The same thing happens to our tissues. If we aim the laser with certain heat subsurface, it's going to shrink. Of course, this temperature should be calculated. It should be around the 40-45 degrees. Otherwise, we are going to cause damage in the tissue. Now, regarding the Nightlase or the snoring treatment with the Photona laser, this is what the company calls that kind of treatment, Nightlase. We are using the non-ablative ErbMYAG and aim it towards the uvula, the soft palate, and the surrounding tissue. So there are 8 spots which we would like to treat: the anterior nostril, the anterior pillars, sorry, and then we would like to treat the hard palate and the soft palate. Then we would like to treat the anterior pillar of the opposite side, and then the hard palate and the soft palate of the other side. And then we would like to treat the posterior pillars, the posterior pillars of the other side, the uvula, and then we need to treat the base of the tongue on both sides. So those are the areas which we are targeting to treat the snoring. Just to let you know, the parameters we are using for this kind of treatment are the same parameters which we are using for the intraoral tightening to improve the nasolabial lines and the marionette line. This is what we do on the buccal cavity in different area in order to achieve tightening in the tissue. Simply, when we are doing these techniques, we are leading to tissue shrinkage, and then as a secondary effect, we are going to get collagen stimulation, and the tissue is going to be firmer. Instead of being loose and lax, we are increasing the firmness of the tissue, and this is definitely improving the tone and improving the upper airway. And when we are doing that, the upper airway is going to be open, and this will improve the oxygenation during the sleep. And that's why patients who are subjected to this kind of treatment are reporting that they wake up much fresh than before. So this is something which is having an immediate impact, and patients are appreciating very much this kind of treatment, which is associated with no pain, no side effects, no downtime. So a major advantage of that technique is that no anesthesia is required. We don't use any needles, no pre or post-operative pain. We are conducting 3 sessions over 2 months, and each session is about 15 minutes. So it's really very quick, not a big deal. And we get immediate result from the first day, an average of 50% reduction in the snoring. This is the technique which we do. Now, Photone has developed the handpieces, and there is another handpiece which is like a glass tube, and it has a mirror which is able to reflect the laser beam 90 degrees towards the tissue. So it's much easier, much more convenient. When I started the procedure, I started it with the PS03 and the R11, and it was okay for me. Definitely with the developments, there might be tools which are making our life easier. However, I was using the handpiece, the R11 or the PS03 handpiece. So we direct the laser beam towards the tissues, which I showed in the first photo. It is really very important to have some sort of objective assessment as well. So in order to get some objective assessment of the tissue shrinkage, patient's oral cavity is evaluated and photographed before and after the procedure. Also, patients are classified according to the Mallampati classification. And this is really a very important starting point, because we cannot jump steps. So it's very important to know which class the patients are at, because according to the initial class we are starting with, we can tell them what to expect, and we are going to show them the progress. So what is this Mallampati classification? It is a classification which is classifying the upper airway obstruction into class 1, where we have fully visible tonsils, uvula, and soft palate. Class 2, where we have visibility of hard and soft palate, as we can see, the hard and soft palate, and upper portion of the tonsils and the uvula. This is class 2. Then we have class 3, where the soft and hard palate and the base of the uvula are visible. And then class 4, we have only the hard palate visible, like this. So I'm going to show you some real examples and real photos. But the important thing here is that the improvement is going to be according to the classes. So if someone is in class 4, whatever we do in the best hands, we are not going to jump and go down to class 1. It is going to move from class 4 down to class 3, or class 3 down to class 2, class 2 down to class 1. So these are the expectations, and this has to be communicated with the patient. So this is a patient with class 2, where we can see that the hard palate, the soft palate, and part of the uvula and the tonsils are seen. So this is the class 2. Then this is class 3, where we can see only part of the uvula and the hard palate and the soft palate. The bottom of the uvula, it cannot be seen. So this is class 3. And now this is class 4, where we can see only the hard palate and part of the soft palate. We cannot see even the base of the uvula. So those are the classes which are really very important to in the evaluation process for the proper expectations of that procedure. The preliminary results were showing that evaluation of the results were made with subjective assessment of the patients answering the questions from a questionnaire. So there is a questionnaire they need to answer. And then patients evaluated average snoring reduction after the first session between 30 to 60%. So the average was about 45%. And after the second session, between 50 to 90% with an average of 65%. All expressed being very satisfied with the treatment and the results. This was the preliminary results of the initial protocols using the Nightlase. Also, there was a polygraph evaluation of the Nightlase efficacy, the first test. Average reduction of snoring index was 52%, and the apnea index also significantly improved, which was about 48%. To my surprise, those results are very much comparable with the surgery, with all the hassle we are going to get through in order to go through surgery, with the pain, with the preparation, the post-operative pain, and sometimes bleeding, potential infection. When we are able to get a technique which is enabling us to achieve this kind of results with no pain, with no preparation, with no post-operative procedure, with no complications, I think this is outstanding. The secondary findings of the procedure were that patients who were suffering periodical and recurrent throat infections claimed that it disappeared. And the rationale of that is that the heat is disinfecting the area, plus it is shrinking the crypts. When the tissue is shrinking, then those crypts, which are a very good medium and shelter for the bacteria, the microorganism, are going to be blocked, and this will eliminate those clones of bacteria in those dead spaces. So this can be considered as a possible treatment for pocket formation or crypts in tonsils that shelter bacteria and generate bad breath. This is something which is, again, outstanding when we are able to achieve this kind of result safely and effectively, with no pain, with no anesthesia required, with no general anesthesia, with no bleeding, with no infection potential. I think this is something which is great. Now, this is the screen of the SP Dynamis, where we can select the Erbium-YAG with the different application. We can select the ND-YAG or the combination treatment with a twin light. When we talk about snoring, then it is the snoring which we are going to be focusing on. Those are the parameters which we are using, where the R11 handpiece, the initial protocol of Fortuna was PS03, but I discussed with them that when we have a problem like this, we need to treat the whole surface. So R11 is more appropriate than PS03. So the 7mm spot is used, 2.5 up to 3.5 joule per centimeter square. Sometimes we can go a little bit more, 3.75, with a smooth mode, of course, 1.6 hertz. And then we do 4 to 6 smooth mode shots. If this is too painful, then we can drop down to 3 shots. And we do 3 sessions every 21. So every 3 weeks, we are going to be conducting a session. So as we can see, the treatment is covering all the areas I discussed before. And the patient is feeling some heat. The heat is very much tolerable. We don't need to apply any kind of anesthesia. And it takes maximum 15 minutes to cover all the areas we need to cover. One of the nice applications which we are able to do is a phone application, which is measuring the snoring. So what I would recommend is to download those applications. There are several of those applications. You can download on your Android or iPhone. And then you have a record of the snoring before the treatment. And then after the treatment, you are going to still use the application in order to record the amount or the snoring quality. and quantity and duration and so on. And then you are going to see the improvement. This is a case where we can see the photograph before and after. And here, this is before the treatment, and then after the initial session, and then later on. So it seems that it is really working. It is really working very effectively. And I was happy to hear the testimonial of Dr. Mohsen, who had only one session, after which he was happy, his wife was happy of him snoring less, but then he didn't continue and things came back. The protocol is 3 sessions, 3 weeks apart, and then I would recommend to have maintenance, maybe 3 times per year, every 4 months, in order to maintain the tissue in good shape. So this is the lecture about the snoring. Very simple technique, no complications reported. It has a lot of value, a lot of good things out of it, without any downtime. And this is, I think, a really very good step forward in the medicine. I think most of the people attending today are dermatologists. So you are not going to be offering this kind of treatment unless you are in a family practice or you are offering many things. However, people, when they know that you are able to do that, I don't think anyone coming for rejuvenation or intraoral tightening or 4D or whatever is not having part of this problem. And knowing that your device can do that, this is an extra service you can provide very easily and very simply, without any hazards, without any complications.